Section 4. Venue and Location. The location of a meeting centre can present some challenges, including how easily people can get there. In rural areas, people are more likely to have further to go between places, and public transport is less likely to be available. People living with dementia and those that care for them might be unable to drive, they might be on a tight budget, or have health and mobility issues, which can make things even more challenging. Some people may not have anyone who can support them to get out to somewhere like a meeting centre. If people have to cross borders into different areas or communities, that can also act as a barrier for some. We have the following recommendations. We suggest meeting centres support attendance by providing information and practical support for potential and returning members. This could include help accessing financial support with transport or accessing community transport. It's important for the meeting centre venue to have a sufficient accessible car park, or at the very least, a safe and convenient drop-off point. Try to ensure promotional material and outreach activities target all places and clearly welcome all people within your intended catchment area. We suggest health and social care professionals provide information and practical support for potential meeting centre members to access financial support with transport or community transport in order to attend. If there are different services, trusts or bodies covering different places in your area, ensure there's good communication between them about what is available, where and to whom. If you are considering attending a meeting centre, if you need additional support to get there, discuss your situation with meeting centre staff or care professionals that you have contact with. They can offer advice on what might be available to you. If you're uncertain if you can attend a meeting centre in a neighbouring area, get in touch and ask. The venue a meeting centre is held in can be crucial to its success and sustainability. It's rare for a meeting centre to have use of a perfect venue that ticks all the boxes. However, it's important to provide a space that is as accessible as possible and as welcoming as possible, and suitable for carrying out a good range of activities. But that's not the only thing to consider. Issues raised by sharing the space with others are also important. When a meeting centre is in a fixed venue and has exclusive use of that space, it opens up a range of possibilities. Staff can adapt the environment and give members ownership of it. You can make the most of having a presence in the community, and you can create a supportive community with others in the same building or area. If the meeting centre is not open multiple days a week, exclusive use is unlikely, which can create difficulties. If the space is shared, staff and volunteers may have to bring equipment, set up and pack away each session. If the venue keeps changing, then the meeting centre may struggle to establish a presence in its community, and members may lose confidence in its future. A venue owner that is invested in and supportive of the meeting centre really helps to ensure it's sustainable. We have the following recommendations. We suggest meeting centres find a venue that's suitable for a range of activities and different needs. Ensure that the venue is a welcoming, accessible environment with good lighting. It should have more than one room for working with different groups or individuals when necessary. It's also important to accommodate the needs of people who may have additional challenges with mobility or hearing, for example. Seek a venue where the meeting centre can establish itself as a permanent fixture if possible, preferably close to the heart of its community. If exclusive use of a venue is not possible, seek one that you can share with other locally valued services and forge connections with them. Try to find one with storage you can use. Seek a venue where the owner benefits from hosting the meeting centre and is invested in its success. We suggest health and social care professionals consider meeting centres as a possible user of any shared community spaces for joint health and social care services. You can also watch our videos on reaching people and membership and external relationships and collaboration. This independent research was funded by the National Institute for Health and Care Research, or NIHR, under its Research for Patient Benefit, Research for Social Care programme. Grant reference number NIHR 201861. The views expressed are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. We would like to acknowledge and thank all Meeting Centre attendees, personnel and partners that participated in this study, as well as our research collaborators at the Three Nations Working Group on Dementia, Nuffield Department of Primary Healthcare Sciences at the University of Oxford, London School of Economics and Political Science, and Worcestershire County Council.